My name is Gopika. I had been diagnosed with cancer. What is cancer, doctor?
Cancer is a disease of cells within the body. And the cells in the body change in some form over the years, triggered by some genetic changes, which are individualistic. And these cancerous cells become autonomous, and they start to grow, and they can grow somewhere else also. And that's the features of the cancer.
What are the treatments prescribed for cancer?
Basically, there are three types of treatments. One is surgery, which was the oldest treatment for this. And the second is radiation therapy. And when radiation was discovered, radiation therapy started. And then it is called radiotherapy. Similarly, later on, the chemotherapy is the last one that has come into, which is really, in fact, is a systemic treatment. Surgery and radiation are local treatment wherever it is done. Whereas chemotherapy or systemic treatment, we call nowadays, we have new drugs, all these things is called chemotherapy in general.
How do you introduce chemotherapy to patients?
Well, I usually introduce chemotherapy as one method of treating his or her disease. And depending on the role of chemotherapy in that particular disease, I will either tell them that this will be the only modality of therapy, or it might be used along with other modalities like surgery, for example, and why chemotherapy will help him or her.
What is chemotherapy?
Chemotherapy is the branch in which you apply drugs or medication to try and eradicate tumor, and usually it is done as part of a multimodality treatment, for different malignancies.
They told you have to come for chemotherapy, 3 sittings, then surgery, again 3 sittings of chemo, and 25 sittings of radiation therapy.
Chemotherapy it's not a painful procedure. I think you are all familiar with drugs being given. Various ailments, you are all aware that various drugs are used for various ailments. And everybody is familiar with antibiotics for infections. Similarly, the group of drugs that are applied for treating a cancer, they are broadly termed as chemotherapy. Most of them are administered by intravenous routes, either as IV injections or through the intravenous drips. It's not painful in that sense.
Was chemotherapy painful for you?
No. I am as normal as I was before.
People are generally afraid of the word called chemotherapy because they relate it to the various things they hear about it, or they think what they know about it.
During the course of chemotherapy, which can last for at least 6 to 8 months, you have a very uncluttered mind. I am a doctor, but I have not gone through the whole gamut of literature about my own condition. I know the basic information, of course, but I have collected information from my oncologist, and I trust him.
What are the commonly occurring side effects of chemotherapy?
The most common ones are being like nausea and vomiting. That's a major one. The second one will be the weakness that is associated with the chemotherapy. And others will be like decrease in the blood counts, hair loss. Those are the major ones.
The side effects as they exist, the loss of hair, you can see my hair gone, and other side effects like constipation, your low blood counts, all these make you sometimes very down.
During chemotherapy, did you have any vomiting and body pain?
No, nothing.
I can see that your nails are discolored.
All these things are temporary in nature.
It's not necessarily, everybody has a hair loss and everybody feels vomity or things like this. Yes, I lost my hair. There's nothing great about that. I lost, but then it comes back.
I wore a wig, I wore scarves, I wore turbans. My nails have grown right back to the original shape and color.
Are there medicines to control the side effects?
Fortunately, for the medical oncologist and for most importantly the cancer patients receiving chemotherapy, we have very good medicines over the last 20 years which can effectively prevent nausea, vomiting. So nausea, vomiting is now almost a negligible problem when we use effective anti-vomiting drugs.
What are the long-term side effects, doctor?
By and large, I think most of the long-term toxicity is controlled by clear understanding of the total dose and frequent monitoring, and try to modify the dose or modify the regimen in cases of expected toxicity or weakness of a particular organ.
How important is liquid intake during chemotherapy?
We want them to take at least 1 to 2 liters every day, because most of the medicines are excreted by the kidneys, some of them through the liver. We want the kidneys to be flushed fully so that you don't have any major side effects to the kidneys with the chemotherapy.
Would you advise patients to follow their routine, such as go to work, go to college, go to school?
Unless we are going through a very aggressive program and this program is causing low blood count and fevers or low platelet count, but most solid tumors would be a one-day affair, come in the morning, go in the evening, and we would encourage them to get back to the normal activities, go back to work, go back to their daily housework, and if it's a young boy or girl, go back to school.
My duty demands a lot of physical work, a lot of traveling. Of course, the doctor told me you can go, but be very careful you don't catch any infection.
Very commonly there is an increased risk of infection, and therefore I tell patients they should try and avoid eating food which is cooked by unknown people outside, for example hotel food. Second, I tell them not to go into crowded, congested places.
Come in on Friday, second half, get out on Sunday, but Monday I'm back to office.
What are the implications of chemotherapy drugs on the vein?
Yes, chemotherapy can be what we call an irritant. It's a chemical and it can irritate the veins, cause inflammation, and sometimes the vein actually gets closed, what we call occluded. So sometimes you cannot reuse the same vein for several months. And in addition, in the short term, it can cause pain, redness and swelling and some discomfort for the patient.
Is there an alternative method of administering the drugs?
Well, there are two issues. One, that is, if the treatment is very long, going for about a year or 2 years, definitely we would advise them a port or a central line, or with a difficult venous access. As we start using the veins and give chemotherapy, the patient's venous access becomes more and more difficult. We can't get the line, we can't get the blood for blood testing, and if there is any crisis situation, the patient is sick, we can't immediately access her system. So if any of these issues exist, we would definitely advise a central line or a port placement.
This patient already has a port insertion done earlier, and there is a round disc area underneath the skin into which the needle is inserted, through which the drugs are administered.
Anyone who needs a prolonged chemotherapy, if the chemotherapy drugs come out of the vein, which is called as extravasation, and cause damage, if we are using that kind of chemotherapy, it would be advisable to have a central line or port. And some chemotherapies could be infusional. You need to give for about 3 days, 4 days continuously. Once again, those patients will benefit with a central line.
Does the immune system return to normal after chemotherapy?
All these side effects, most of them, will recover completely, including the immune system. Immune system especially takes a little longer because it has to build up, but say 3 to 6 months, but it will come back to normal. Of course, when the white cells come back after each course, that part of the immune system is not a problem. Our infection fighting system is not a problem. But the general immune system takes a little longer to recover.
Are alternative system of medicines like Ayurveda and homeopathy advisable during chemotherapy?
It is not advisable to have those because we don't have proper documented evidence that it doesn't interact with our chemotherapy drugs. and it can have major side effects sometimes. We don't want to face those problems.
Does chemotherapy have an effect on fertility?
Not all chemotherapy agents are straight away equated to infertility. Many of our patients who have successfully been treated for malignancies, they go on to have a normal life, and many of them have come back with children, and we will be very happy to see such patients.
How do you help patients manage their stress?
I actually go into a lot of philosophical discussion with them about why they get stressed in the first place and what it is that they are stressed about and what is worrying them about the disease. And by dissecting the different elements of the disease and the future outcome and looking at life as a whole and what life means to them and why they want to live and so on and so forth, I actually usually get them to relax. It may not necessarily be in one session. It might involve more than one session. And usually patients also tend to relax if they feel that the doctor cares for them, that the doctor is actually interested in what's happening to them, and that they will give personal attention. So that's very important, to build a very good relationship where they trust you and where they think that they can look to you for any problems to be solved.
The support system that immediately comes to mind is the concept of God. That's a very strong support system, and people who have belief in God can face this problem a bit easier. But then I am an atheist, and I don't have that luxury. So my support systems have been my friends, my immediate family. They've been a great pillar of strength and support.
Besides their family and friends, patients can turn to the cancer support group within the hospital, who is always ready and willing to listen to you, talk to you, and clear all your doubts and fears. I spoke to doctors, I spoke to patients, but chemotherapy is also about survivors and their experiences.
Perhaps right from the start, I had made up my mind that I was going to fight this, and I was going to do my very, very best to get well.
When I was diagnosed with breast cancer 15 months ago, as Neja said, it was very shattering. Even though I was a member of the support group, I felt in need of support.
என் பையன் ஒரு ஸ்பெஷல் சைல்டாக இருந்தும் கூட நாங்கள் தைரியமாக இந்த ட்ரீட்மெண்ட் பண்ணோம்.
The first time my mom got cancer was when we were 7 years old, and we really didn't know much about it then. You know, children can also support their parents. Of course, they can't do much, but just show love and warmth.
I don't think I would have ever been able to have gone through all of this without the support that I had from my family, my husband, my sons, and the tremendous support I had from the hospital, also from my doctors. And another thing was a sense of humor. I really went through a lot of my treatment laughing because of my doctors.
One day I was playing with my daughter, Devaki. We both were playing on the bed. What happened was that when I was clapping and I was showing her my hands, and I told her, Devaki, you show your hands. And all of a sudden I saw her hands were very white. So I told Devaki, something is wrong with you.
9th முடிக்கும்போது எனக்கு ஒரே வயிற்று வலி வந்தது. அப்புறம் ஒரு நிறைய டயக்னைஸ் பண்ணாங்க, நிறைய எக்ஸ்ரே எடுத்தாங்க, அப்புறம் அல்ட்ராசவுண்ட் எடுத்தாங்க. வயிற்று திறந்து தான் ஆப்ரேஷன் பண்ணணும்னு சொன்னாங்க. அப்போ நான் 10th படிக்கணும் ரொம்ப ஆர்வத்தோடு இருந்தேன். அப்போ ஒன்றும் செய்ய முடியல.
For a moment I was a little stunned, but within myself I just had this belief that this can be curable, because I've heard about this chemotherapy a lot. At that time, she was only 3 years old. The first treatment, she was very delicate. She was very irritated. It's because a lot of chemicals reaction is taking place in the body. She was not herself. But we have to go through it. I mean, we have no choice.
எனக்கு ஸ்கூல் போகணுன்ற ஒரே ஆசை வேண்டியதாக இருந்தது. எனக்கு வந்து இங்கே இருக்கிறது ரொம்ப எரிச்சலாக இருந்தது. ரொம்ப ஒரே ரூமில் உட்காந்து எத்தனை நேரம் தான் ஒரே 4 சுவரை பார்க்குறது ஒரு மாதிரியாக இருந்துச்சு. ரொம்ப மெடிசன்ஸ்லாம் வேறு ரொம்ப லோ ஆகிடுச்சுன்னு ரொம்ப டிப்ரெஸ்ட் ஆகிடுச்சு. ரொம்ப ரெஸ்ட்லெஸ்ஸாக வேறு ஆனேன்.
I always tell her, say that I'm all right, I'm healthy, I'm doing fine.
செப்டம்பர் 1 எனக்கு பர்த்டே. அன்றைக்கி தான் நான் ஃபஸ்ட் இந்த ஹாஸ்பிட்டல்லேருந்து டிஸ்சார்ஜ் ஆகி போனேன். அதுக்கப்புறம் ஒரு 10 days கழிச்சு வீட்டிலே உட்காந்து படிக்க ஆரம்பித்தேன். எனக்கு வந்து அப்போ 10th போர்டு எக்ஸாம் படிக்க வேண்டிட்டு இருந்தது. வீட்டில் உட்காந்து டிசம்பர் வரைக்கும் படித்தேன்.
நம்ம ரொம்ப ஆப்டிமிஸ்டிக்காகவும் ரொம்ப என்தூசியாஸ்டிக்காகவும் இருந்தால் இதை பற்றி ரொம்ப கவலைப்படாமல் இருந்தேன். அதுவே பாதி கேன்சரை க்யூர் பண்ணிடும்.
10th வந்து 89% வாங்கினேன். அப்புறம் கோர் சப்ஜெக்ட்ஸில் ஒரு 96% வந்தது.
You just know that, all right, here is someone who is suffering what you went through. And when that person gets to know that you've been there, done that, you're not just someone who walks in and says, hey, be positive. You say, look, I've been there. And if I can do it, so can you. That is the ace all of us survivors have, because when we talk to someone, we know what we're talking about because we've gone through the surgery. We've gone through the chemotherapy. We've gone through the side effects, whether it's discomfort, nausea, hair loss. We've gone through the entire gamut of experiences. And here we are, with God's grace, with our doctors who are like gods to us. Here we are, having conquered and battled everything.
Hi, my name is Gopika. I have undergone 10 cycles of chemotherapy. Chemotherapy, I will never say, is easy. In fact, it is a difficult time. And for some people, it can be very, very difficult. But from my own experience, I can tell you that life during chemotherapy can be made much better if there is a lot of love and support from your family and friends. B, trust your doctors completely. C, have lots and lots of positive thoughts and attitude.
It could happen to anybody, I'm telling you again, but then I'm living a normal lifestyle.
And I'm leading a perfectly normal life and anybody can do it.
Chemo எடுத்ததால நீங்க எதுவும் பயப்படாதீங்க.
Through all its difficulties, all one requires is a positive attitude. If I can do it, anyone can do it. It's not also hard.
Good luck. Let's fight this disease together because it is conquerable.
So here's to fighting it, here's to facing it, and here's to conquering it with the help of chemotherapy.
The important thing is to say we are going to fight this disease. But to fight a cancer, you should fight the fear of cancer first. And that, I think, is what you have to keep in mind, that nothing is going to happen to you and you are going to have a good fight against this disease, and with that fight you can always win.
In short, I will only tell you that believe in God, believe in yourself, and believe that you can cure cancer, and believe the chemotherapy is not the end of life. Life goes on even after chemotherapy. In fact, beautifully.
Loka samasta sukhino bhavantu. Loka samasta sukhino